A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. VAIDEHI ma'am. So we welcome you, ma'am. We welcome all the participants today for the today's session. Today we'll be having the topic regarding beyond hormones, hypothyroidism through the lens of the homeopathy and GNM. And so we'll be having a small introduction regarding ma'am. So, ma'am has been working HOD and professor of AIHSAYA Homeopathic College from the Department of Homeopathy Pharmacy. Ma'am is also having a clinic by the name Vedic True Healthcare. So, ma'am is also serving through the clinic also to the patients. So, ma'am has been also an examiner in various universities like Paril University, Bhavnagar University, and other universities also, some of the other universities. And ma'am has also did training in various workshops and attended IAP, AAP, and neonatal resuscitation programs also. So ma'am has also attended many national and international webinars, seminars also, along with the many more publications. So we welcome you, ma'am. We welcome you all the participants, and session is all
Thank you,
yours.
dear, for the introduction.
Yes, ma'am. Yes, ma'am. Session is all yours, ma'am. Yes, ma'am.
So my slide is visible to you.
Yes, yes, ma'am. Yes, ma'am.
So good evening, one and all present on this session. Thyroid, a very tiny gland. It is mighty, but have a psychiatric imposter. So let's understand this core today. Today's our topic is beyond hormones, hypothyroidism through the lens of homeopathy and GNM. So today we will learn about some of the anatomy, physiology of the thyroid, then the hypothyroidism, basic introduction, and then we will consider the homeopathic approach related with the GNM point of view and homeopathic point of view, and few cases regarding the hypothyroidism. So our endocrine system is working as a hormonal orchestra, and our hormones are control and coordinate body's metabolism, energy level, reproduction, growth and development, and response to injury, stress and mood. So various endocrine glands are there like hypothalamus, pituitary, thyroid, parathyroid, adrenal, pineal, ovaries and testes. So today we will learn about the thyroid gland. So thyroid gland is situated in the anterior part or anterior neck between the C5 to T1 vertebrae, and it has two lobes and butterfly shape appearance, and it is wrapped around the cricoid cartilage. If we consider or if we going through the thyroid hormones, there are three types of hormones secreted by the thyroid gland, that is the T3, T4 and calcitonin, and it is regulated by the hypothalamus by secreting the thyroid releasing hormone, going to the pituitary gland and influences to secrete the TSH, that is thyroid stimulating hormone, and TSH is responsible for release of the T3 and T4 from the thyroid gland. So it is about the hypothalamo pituitary ovarian hypothalamo pituitary thyroid axis, and this is regulated by the positive and negative feedback mechanisms. So if we go through the functions does by the thyroid hormone in our body, it will regulate the metabolism, it will produces or regulate the energy functions influences the calorie production and burning of the calorie. It regulates the temperature of the body. Even cardiac rate is regulated by these hormones. Our growth and development, especially in a kid, is depend on the thyroid hormone. So proper thyroid hormonal secretion is needed for the bony growth, for body growth and brain development. Then it will act on the muscle system and gives it strength and performs the functions of the muscles. And then on the digestive tract, it controls the bowel movements and appetite, and that's why person is not suffering with the constipation and appetite loss or appetite increase. Then if thyroid having a dysfunctional activity, or if it won't work, then there is the development of the various conditions like hypothyroidism, that is the underactive thyroid. There is a decrease in a secretion of the thyroid hormone and produces symptoms like the fatigue, weight gain, cold intolerance and depression. And if the it will overactive, then this overactivity will lead to development of hypothyroidism or thyrotoxicosis. And this excessive production of the hormone will lead to increase in a BMR, and that will resulted in a weight loss, rapid heart rate, anxiety and heat intolerance. Then the development of the goiter, that is the enlargement of the thyroid gland. Often it is related with the iodine deficiency. Thyroid nodule, that is the abnormal growth and lumps in the thyroid gland, which may be benign or malignant. So today we will going to learn about the hypothyroidism. Originally, hypothyroidism is related with the iodine deficiency, it is related with the goiter, it is related with the decreased hormones or development of the nodules with the age. So primary hypothyroidism, if we see in the epidemical ratio, 1 in 100 cases we will find related with the hypothyroidism, but subclinical stages are 5 in 100. Pregnant woman 1 in 10 is suffering with this thyroid insufficiency or hypothyroidism. Male, if we consider the male female ratio, it will seen in a predominantly in a female rather than in a male. So among 6 cases compared to 1 case in a male, we will find in a 6:1 ratio in a male female. Then if we consider the prevalence in India, we will find the 11% of the cases among the hormonal disturbances we will find related to hypothyroidism or related with the thyroid disorder. So hypothyroidism is a condition where the thyroid having a underactive activity, and they are not able to produce the sufficient amount of thyroid hormones, and this insufficiency will lead to development of this decrease in a BMR and problems related with the hypothyroidism. So types of hypothyroidism are congenital hypothyroidism. It is related with the birth of the baby, and among the 2,500 to 3,000 babies, we will find one baby having a congenital hypothyroidism. It will have a genetic predisposition also. If mother is suffering with the hypothyroidism, there is a possibility a newborn one will also suffer with the congenital hypothyroidism. Then primary hypothyroidism, it is due to the inadequacy of the production of the thyroid hormone. Then secondary hypothyroidism, it is due to the other glands like pituitary or problem with the hypothalamus, and that deficiency of TSH will lead to inadequate stimulation to thyroid, and thyroid is not able to release the T3 and T4. Then the tertiary hypothyroidism, it is the deficient TSH secretion due to problem in a pituitary. If it is not giving thyroid releasing hormone, then pituitary not able to release the TSH. So in tertiary hypothyroidism, there is a problem related with the hypothalamus. In subclinical hypothyroidism, Subclinical hypothyroidism is elevated serum TSH in patient with the absence or minimum symptoms of the hypothyroidism or normal serum levels of thyroxine. So, what are the risk factors for the development of the hypothyroidism? As we know, women are more or much likely than men to develop hypothyroidism. Some of the cases we will find with the advancement of the age, like people older than the 60 years. If someone undergo through the any surgical measurement or any radioactive iodine therapy, then they will suffer with this thyroid problem. A person having goiter or radiation treatment related with the neck, thyroid or chest, having family history of the thyroid disease, and pregnant woman after pregnancy in last 6 months, if she delivered before 6 months or during pregnancy, then the Turner syndrome as a genetic disorder that affects the woman. Then some of the systemic illnesses also affect the secretion of the thyroid, like celiac disease, that is the lactose intolerance, Sjogren's syndrome, again autoimmune disease condition. Then the pernicious anemia due to atrophic gastritis caused by the vitamin B12 deficiency. Then type 1, type 2 diabetes, rheumatoid arthritis, and SLE. Then, what are the causative factor or contributory factors for development of the thyroid hormone? So, we find the Hashimoto thyroiditis or Hashimoto's disease, that is the enlargement of the thyroid gland like a goiter. Then, thyroiditis or congenital hypothyroidism, having family history of the thyroid disorders. Then, surgical removal of part or uh, a part of thyroid or a whole thyroid. Then the radiation treatment during pregnancy, few medications, then problem present at the birth and not enough iodine. If we consider this Hashimoto thyroiditis, again an autoimmune disease condition where there is the inflammation of the thyroid gland. In thyroiditis, in a primary situation, it will cause thyrotoxicosis, that is the hypersecretion of the thyroid hormone, that is followed by the hypothyroidism. So there is the development of the subacute thyroiditis, postpartum thyroiditis, or silent thyroiditis, and that will develop or resulted into the enlargement of the thyroid gland. Painful inflammation is there, and if it is painless, only the enlargement is larger like a goiter. Then congenital hypothyroidism, then surgical removal due to the large goiter or hypothyroidism or any malignant condition or thyroid nodules or carcinoma. Then the radiation therapy, someone we give the radioactive iodine therapy as a part of treatment of the thyrotoxicosis or hypothyroidism. This decrease in a thyroid hormone resulted into the development of the hypothyroidism. Then the medicines related with the heart conditions or bipolar disorders, some psychiatric condition, and cancer medicine, that is the chemotherapeutic drugs like methotrexate, chymotrypsin, has resulted into the development of the decreased thyroid secretion. Then the problem present at the birth, if it is not working from the birth, now baby may develop into the cretinism. Then the pituitary disorder of the secretion from the pituitary, that is the TSH, is fail. It will resulted into the decreased response of the thyroid gland to secrete T3 and T4 in a circulation. During pregnancy, there is the development of the hypothyroid stage due to the consumption of the thyroid hormone by developing fetus. So, if there is the development of the hypothyroidism during pregnancy, there may be a premature delivery or development of preeclampsia or pregnancy loss. Then, this not enough iodine intake also resulted into the decrease in the less production of the T3 and T4, and that's why there is a lacking in a secretion in the body. So, what are the clinical features related with the thyroid disorder? thyroid disorder or hypothyroidism, we will divide this hypothyroidism into the primary hypothyroidism and secondary hypothyroidism. Primary hypothyroidism, in an initial phase, it is asymptomatic. Often the symptoms develops insidiously. So most common presenting symptoms are the fluid retention, puffiness, weight gain, tiredness, this cold intolerance or temperature variation intolerance, and mental fogginess or forgetfulness. So this fatigue, loss of energy, lethargy, it is having a person having a feeling of exhaustion every time by the slightest work. It is not related with the sleep or rest. Then the cold intolerance, that is the weight gain due to the fluid retention and decrease in a metabolism or decrease in a BMR. Then hypothermia, this weight gain is also not related with the food intake or fat or sugar metabolism. There is the problem with the weight gain due to the you can say decrease in a BMR or originally absorption or digestion capacity may vary. So person having this puffy look of the face and moreover weight gain is surrounding around the abdominal or truncal obesities. Then appetite is decrease, feeling cold, cold intolerance, then forgetfulness, paresthesia in a hands and feet, numbness, there is the slowing and relaxation of the deep tendon reflexes, then the sleepiness, having muscle pain, joint pain, weakness in the extremities, then pains, stiffness, swelling of the joints, tenderness. Then this facial puffiness is look like myxoedema. It is due to the deposition of the polysaccharide-like material on the face. There is a loss of hair, sparse, pose, dry hair, falling of the hair, scaly scalp, dandruff, then the macroglossia, dull, thin nails, brittle nails, and decreased perspiration. There is hair loss from the scalp, eyebrows, legs, or other body parts. There is a problem like development of the alopecia areata or having alopecia, you can say sarcinata, due to it is related with the autoimmune conditions. Then mood swings are there, mood changes, memory changes, forgetfulness are there, anxiety, depression, apathy, sorry. Then the low mood, slow thinking, slow speech, impaired memory, inability to concentrate, personality changes, then dull facial expression, dementia, or frank psychosis like myxoedema madness. Then person may suffer with the constipation due to lack of the movement of the gut, then menorrhagia and secondary amenorrhea. Then other menstrual disturbances are there and that will result into the infertility. As we already seen, there may be a premature delivery or pregnancy loss or development of the preeclampsia. So in menstrual changes, there may be a heavy or irregular menstrual periods or spotting in between. Smatorrhagia, menorrhagia may be present. Then hypothyroidism causes the problem because it affects the other hormones that will play a role in a menstruation. Because it is related with this hypothalamo pituitary ovarian axis also, it will impair the degeneration of the estrogen and reduces the amount of sex hormone binding globulin, and that's why there is a problem related with the menstrual cycle and related with the fertility and ovulation. Then periorbital swelling due to the infiltration with the mucopolysaccharides, and there is a dropping of the eyelids because of the decreased adrenergic drive, decrease or impaired hearing, development of the goiter, that is the enlargement of the thyroid gland, and other symptoms like frequent coughing, problem with the voice quality, development of the hoarseness, then problem in swallowing and breathing. Then this will also develop the deposition of the cholesterol in the body. So this low hormone level, liver will struggle to carry out the blood cholesterol, and that's why individual will suffer with the high cholesterol due to underactive thyroid. Then there is the development of bradycardia due to the decrease in thyroid hormone and adrenergic stimulation. Then enlarged heart on examination and imaging. So this effects may include the changes in blood pressure, variation in heart rhythm, and less elastic arteries. So this bradycardia can cause the weakness, dizziness, and breathing problems without treatment. And heart condition may result in serious complications such as development of the chronic hoarseness, physics, having the presentation, slow speech, speaking of the skin, speaking of the eyebrows, low body temperature, slow heart rate, and poor confusions. Other physical signs are weight gain, slow speech, and slow movements. Maybe development of the jaundice and pallor, dry skin, coarse brittle nail, then loss of scalp, axillary, and pubic hair, then dull facial expression, coarse facial features, and periorbital puffiness, then macroglossia. Then there is the development of the pitting edema, then abdominal distension, bradycardia, pericardial effusion, then the goiter, then pitting edema over the lower extremities, then hyporeflexia with the delayed relaxation. So, if primary hypothyroidism is developed due to the Hashimoto thyroiditis, we will find the feeling of fullness in the throat due to enlargement of the thyroid gland, then the painless thyroid enlargement, exhaustion, then transient neck pain, sore throat, or both. In secondary hypothyroidism, person is suffering with the skin dryness, pigmentation, hair loss, macroglossia, atrophic breast, history of amenorrhea rather than menorrhagia, then low blood pressure, heart is comparatively small, and no serious pericardial effusions are there, but hypoglycemia may be there. If the secondary hypothyroidism is developed into the myxoedema coma, it is the acute crisis related with the thyroid. The features are like altered mental status, hypothermia, bradycardia, hypercapnia, hyponatremia, then cardiomegaly, pericardial effusion, cardiogenic shock, or ascites. As we seen, there is a decrease in a hormonal secretion in a babies or infants. Infants may suffer with the feeding problem, poor growth, poor weight gain, constipation, poor muscle tone, dryness of the skin, hoarse crying, enlarged tongue, jaundice, and umbilical hernia. So when the hypothyroidism in infant is not treated, even mild cases can lead to a severe physical and mental developmental problems. So, as hypothyroidism in children and teens is known as cretinism, it is the problem in a development of them. So, there is the poor growth lead to a short stature, then delayed development of permanent teeth. Milestone is delayed puberty, problem with the menstrual cycle, and poor mental development, and other symptoms related with the adult. So how will diagnose this hyperthyroidism? So we can go with this blood body profile or thyroid function test profile that includes the TSH, free T3 and free T4, then thyroid antibodies, that is the thyroglobulin and thyroid antibodies. Then we can go through, if the enlargement of the thyroid gland is bigger, we will suggest about the sonography of the thyroid gland. So thyroid scan is needed to find out some nodule or any other changes in a thyroid gland. So thyroid scan, ultrasound, and this blood thyroxine profile or thyroid hormone profile will lead us to diagnose the hypothyroidism cases. Then what are the complications caused by the thyroid? That is the enlargement of the thyroid gland, goiter, some heart problems, peripheral neuropathy, infertility, birth defects, and myxoedema. So goiter is the enlargement of the thyroid gland. Heart problem, as we already seen, it is related with the higher risk of development cardiac disease or may lead to the heart failure. There is the problem with the lipid metabolism, lead to increase in amount of the bad cholesterol. Then the peripheral neuropathy, then infertility due to the less sexual drive, and it is related development of the PCOD due to the problem of the estrogen intake and work. Then the birth defect, it is the slow or developmental delayed in a babies. There may be a development of the low birth weight baby or serious some physical and mental developmental problems. Then myxoedema coma, as we already seen, it is related with some stress or infection or some medicine. There may be a development of intense cold intolerance, drowsiness, followed by the extreme lack of energy, unconsciousness, and this myxoedema coma requires emergency treatment. So, by the conventional method, they will supply the synthetic hormone to replace our body's natural thyroid hormone. So, sometimes this exogenous synthetic hormone causes the hypersensitivity reaction in an individual, and they may suffer with this urticaria pruritus, skin rash, flushing, angioedema, other GI symptoms like abdominal pain, nausea, vomiting, diarrhea, then fever, then joint pain, and serum sickness, and whizzing sound in a ear. So now let's go with the homeopathic approach in this type of cases. Homeopathy is the growing system nowadays, and we are believe in a holistic approach towards the sick individual through the promotion of the inner balance at mental, emotional, and spiritual physical levels. So we treat a person as an individual. So individuality of the patient, considering the mental and physical symptoms, we find the exit simillimum for that patient to recover them from this condition. So we consider onset of the disease, severity, age, any presence of autoimmune conditions related with the it. So history plays a vital role for the selection of the homeopathic medicine. So our aim being a homeopath is to stimulate the body's natural healing abilities. So now we can correlate this German new medicine with the homeopathic system. So what is this German new medicine or GNM perspective originally? GNM, German New Medicine, is an alternative healing approach that seeks to understand the emotional and psychological stresses that contribute to disease. So this disease may originate from the dynamic disturbances and followed by the functional and pathological changes. So this morbid conditions start from the conflict in the psych level, and later on it reflects on the body as a physical sign and symptoms. So common feature is the disturbance at the all level of the men. So if we consider this biological conflict related with the GNM and thyroid gland, thyroid disorder is related with the powerlessness conflict where person believes I can't keep it up, I am too slow, I am unable to act fast enough. Then the self-devaluation conflict, that is a feeling of being inferior or incapable, especially links to performance and mental ability. Then overburden conflict, that is the responsibility one. If someone feeling overburdened by the responsibility, pressure to perform, or any emotional stress related with the family, friends, and spouse. So these are the reasons biological conflict according to GNM for development of changes in a thyroid hormone and leading to development of hypothyroidism. So what are the target sites? So thyroid gland is affected, especially follicular epithelium, that is responsible for releasing T3 and T4 hormone, and it is related with the cerebral medulla where there is the self devaluation conflict is activated. So if a person having a right handedness, then conflict is related with the partner, and if it is with the left handed person, conflict is related with the mother or child. Then in a conflict active phase, there is the increase in a thyroid function lead to hyperthyroidism, and body tries to speed up the functions, and there is the increase in a BMR, and all symptoms are related with the increased metabolic activity. In a conflict resolution phase, there is a tissue repair and reduce the function, and that will lead to the hypothyroidism, and that will result it into the fatigue, cold, and weight gain. So we will recognize and resolve this emotional conflict and allow the natural healing process without any separation, and with the use of homeopathic medicine to support healing based on the individual's totality and emotional blueprint. So let's discuss this point with the organon point of view. In organon, in aphorism 5, so that is the consideration of the psychic cause of the chronic disease. So in GNM conflict, there is the powerlessness, suppressed emotion must be explored along with the physical symptoms. In aphorism 6, it is related with the totality of the symptoms, where will include the mental dullness or weight gain or sadness or coldness or hormonal disturbances and emotional triggers. Means all the symptoms related with the mind, body, and emotionality should be considered in a totality. Then aphorism 7 related with the causa occasionalis, it is related with the exploration of the emotional trauma or having any stress history like grief, performance pressure, or any thyroid dysfunctions. Then in aphorism 9, that is related with the disturbance of the vital force. In hypothyroidism, it reflects a slowdown of the vital force and often from the unresolved emotional conflicts. Aphorism 16, it is related with the dynamic disturbances. So in thyroid dysfunction, there is not just a hormonal deficiency, it is the dynamic imbalance in a thyroid activity. In aphorism 1718, it is related with the individualized medicine selection. This selection is based on the totality of the symptoms, not on the hormonal value that we will find in a laboratory reports. Then aphorism 26, it is related with the internal or external causes, that is the emotional internal conflict manifested as a thyroid disease. Then 29 and 30 aphorism says about the artificially created or removed dynamic disease condition by the medicine. That is the homeopathic medicines like sepia, lycopodium, iodine stimulate the disturbed energy and back them to health. Then aphorism 72 to 82, that is the classification of the chronic disease. So originally hypothyroidism considered under the chronic miasmatic disorder, and moreover it is related with the psoriatic and psychotic miasm. Sometimes if it is related with the carcinomatous condition, it can correlate with the syphilitic or tubercular miasm. Then aphorism 104, 105 on basis of the prescription. So this prescription is always based on the totality. So if we consider the miasmatic perspective in a hypothyroidism, so in case of SORA, there is the functional disorder. So in hypothyroidism, there is the development of the fatigue, cold intolerance, depression, low motivation, sluggish metabolism, constipation. So over here, we consider the medicines like sepia having indifferency, calcarea carb having a weight gain, weakness, anxiety, fear, silesia having aversion to exertion. In psychotic miasm, that is the overgrowth or accumulation related with the glandular swelling like a goiter, there is weight gain, fluid retention, edematous condition of the extremities, and recurrent infection, mostly related with the cold and cough. Then here we consider the thuja, natremure, and lycopodium. Thuja having overgrowth, natremure having a grief or activation of various conflict, and lycopodium having a glandular affinity and bloated filling. Then in the syphilis, there is the destructive changes, there is the advanced or irreversible thyroid damage like autoimmune thyroiditis, that is the Hashimoto thyroiditis, and having suicidal depression. So over here we consider this aurum metallicum, merxol and phosphorus. Aurum having suicidal thoughts, merxol having destructive glandular inflammation, and phosphorus having a degenerative thyroid condition. In tubercular condition, that is the rapid change or alternating symptoms. Here, the fluctuation in a TSH level, alternating fatigue and restlessness, then various allergies and infections related with the thyroid issue. So here we can consider medicine like the iodum, Barytica pulsatilla, iodum having restlessness and decrease in a BMR or hypoactivity, Barytica forgetfulness, weakness and glandular atrophy, pulsatilla having a changeable mood and changeable hormone, and that's why it is also indicated in a cases of PCOD. So over here, if we see the how organons support the GNM view, according to this aphorism 9 and 16, vital force, this biological program is triggered by the psycho-emotional conflict. Then in aphorism 5, there is the explosion of the causa occasionalis. So GNM insists to find out the biological conflict as a shock. In aphorism 6, GNM identifies the psych, brain and organ connections. And aphorism 17, this both reject the mechanical cause only, that is the replacement of the hormone. No, just focus on the root healing. So let's start with the medicinal approach, or let's see few medicines related with the thyroid gland or hypothyroidism. So first is the Asteria rubens, indicated in a indurated thyroid gland, slow metabolism, weight gain, sluggishness, and it is useful in a strophanous constitution, having deep insecurity, repression, and feminine identity conflict. Fucus vesiculosus, having thyroid enlargement, obesity with the flatulence, improved basal metabolism, and useful in goiter. There is a bloated feeling emotionally and physically. It is related with the burden or responsibility conflict. Thyroidism, glandular dysfunction, obesity, depression, constipation, dry skin, and hypo or hyper conditions. So there is the development of the rebalancing post-conflict or healing phase. Then the lepus albus, goiters with tendency to hard nodular growth. Then there is the syphilitic miasm and chronic grief and trauma. Then spongia tosta, there is the hardness, dryness, and enlarged thyroid gland, suffocation like sensation, slow pulse, having emotional tightening or suppressive conflict. Then iodine, rapid metabolism lead to burnout, this hormonal status or hormones, and that is to development into the increased BMR activity. And here conflict is I am not fast enough, and this overdrive phase lead to eventual exhaustional phase. Then the phytoleka, originally a glandular remedy, thyroid inflammation, pain, hardness. There is anger and guilt, uh, that is swallow, and this conflict resulted into the hypothyroidism. Bromia, thyroid enlargement, difficulty breathing. There is the insecurity or identity conflict in a bromium. Carcinosin, strong inherited tendency over response by the children. So long lasting separation, perfectionism, and anticipatory anxiety. In Baraita cup, there is a slowness of the milestone, that is delayed development, glandular atrophy, mental dullness, sluggishness, shyness. So here the neglected conflict is activated in a kid. Then bromiomyodatum, scrofulous glandular affection with induration and fibroid in a thyroid gland. There is a deep repression and syphilitic tendency. In magnesium mure, that is the constipation, liver and thyroid dysfunction, coldness, nervousness, with silent grief or maternal resentment resulted into the development of hypothyroidism in a kid due to the suppression of the emotions. Then thioiodinum bovinum, it is the SAR code used in a thyroid dysfunction when the symptoms are mimic like a glandular exhaustion. So it is related with the fatigue or post or long standing conflict related with the organ failure. Then chlorinum, glandular hardening, mental dullness, weak memory, use in a fibrous degeneration. That is the lack of identity and suppressed fear. Then iris versicolor, thyroid disturbances with the periodical headache, indigestion, and boning symptoms. There is performance pressure, performance anxiety, and digestive problems. Sarsaparilla, glandular swelling, sluggish system, indolence, and chilliness, having tubercular and syphilitic tendency. Then the thalassobursa pastoris, it is related with the hypothyroidism symptom and hormonal irregularity related with the menorrhagia, dysmenorrhea, and obesity. So here hormonal conflict post childbearing or miscarriages is responsible. Then Lactanthus tinctoria, it is useful in a thyroid enlargement, stiffness with sensation of head being drawn back. Here a self devaluation conflict is activated. Then tuberculinum bovinum, rapid miasmatic deterioration, restlessness, thyroid dysfunction, alternating with the skin and lung symptoms. Here, the dissatisfaction or inner rebellion conflict is activated. Plumber myodatum, atrophic thyroid, degenerative cases, suffering with the constipation, mental dullness. Here, the end stage pathology, destructive tendency, syphilitic conflict in a resolution stage is activated. And NASA, thyroid, cardiac, and emotional suppression associated with the guilt and thyroid symptoms. Here, emotional shock, grief, and there is the involvement of the hormonal and cardiac activities. Then, rapus renalis, glandular stasis with the lymphatic congestion, especially in obese and scrofulous patient. There is the retention, emotional or physiological conflict is activated. In pulsadilla, Hormonal imbalance, changes in a mood, delayed menses, chilly, tearfulness, yielding disposition. Here, emotional identity or female identity conflict is activated. Sulfur, lazy, hot, craving sweets, aversion to bathing, a philosophical skin issue. Here, ego conflict or overactivity or intellectual identity loss conflict is activated. Nux vomiga, irritable, constipated, chilly, overwork, addicted, sedentary lifestyle. Here the performance pressure conflict is activated. Ferrum metallicum, weakness, exhaustion, pale face, chilly, anemia, sluggishness. Your conflict of duty or inability to fulfill of expectations are there. Phosphorus, weakness, sensitivity, anxiety, craving, open nature, fear of being alone. Here, fear of abandonment or vulnerability conflict is activated. Kalika, fatigue, lower back weakness, intolerance of cold, and stubbornness. Here, insecurity or fear of losing control is there. Then, selenium metallicum, mental and physical weakness after exhaustion, hair fall, sexual debility, sluggishness. Here, identity or performance related conflict. Alumina, alumen, induration of the glands, sluggish bowel movements, emotional coldness or introvert. Your deep emotional control or silent grief conflict is activated. Hyper self, calcarinium, that is the sensitivity towards the cold, throat swelling with pain, irritable, sluggish reaction. Your vulnerability, unsafe or insecure conflict is activated. Valeriana officinalis, here it is related with the functional nervous disorder, hysteria, thyroid-related nervousness and restlessness. It is due to the suppressed emotions, grief, excitement. Ammonium muriaticum, obesity with the fatigue, coldness, glandular swelling, constipation. Here the unresolved grief, heaviness in the body, loneliness activated. Then Kali arsenocosum, it is related with the depression, weakness, sensitivity towards cold, hormonal imbalances and despair. Here, this development of the syphilitic diathesis, hopelessness, destructive grief, and self blame. Then, Simsifuga racemosa, hormonal mood swings, chilliness, muscle stiffness, menstrual irregularity. Here, conflict is related with the femininity and grief. Umbra grigia, timid, shy, unable to express the thoughts, trembling, worse company, sluggishness. Here, the social devaluation, performance, anxiety, and sensitivity to criticism is activated. Then the causticum, weakness, thyroid swelling, slow movements, emotional suppressions, sensitive towards injustice. Then the idealistic conflict, suppress anger, feeling powerless. Then cyclamen, gloomy mood, drowsiness, hormonal headaches, chilliness. There is emotional guilt, self-devaluation or self-rejection conflicts. Then in a muscus, hysteria, fainting, glandular weakness, obesity with nervous stress. Here, the suppressed sexual or oversensitivity or feminine energy imbalance are there. Then the ammonium carbonicum, obesity, sluggishness in a circulation, hormonal fatigue, and respiratory weakness. Here, they have a feeling physically and mentally, and person feel emotionally suffocated. Then ignatia, here the grief, emotional shock, contradictory tendency, hysterical symptoms, deep sighing, having a sensation of lump in throat. Here acute grief or suppressed sadness from the sudden separation. So separational anxiety conflict is activated. Then conium, induration of the glands, mental dullness, sluggishness, slowness, dizziness, which is aggravated by the emotional suppression. So here the suppression of the sexuality, guilt or social withdrawal. Then the rustox, Here the muscular stiffness, restlessness, which is aggravated by the forced motion, constipation, and hormonal irregularity. And it is due to the burden of the emotions, physical strength, wanting of the movement, but feeling blocked. Then the anacardium orientale, it is related with the dual madness, memory loss, irritability, weakness of the will, and hypothyroid type of dullness. So here conflict is related with the self-devaluation or inferiority, then dependency and lack of self-trust. So if we consider few of the biochemic medicine to use as a supplementation in case of hypothyroidism. So Calcarea force having this glandular atonicity, fatigue, chilliness because it act on the bone and glandular growth. It is related with the powerless, delayed or developmental stimuli. Then Calcarea 4 for the hard enlarged glands, fibrous and stony hardness, poor elastic tissue. It is related with the deep depression, natrum muriaticum, dryness, thyroid dysfunction, fatigue, constipation, hair fall, sadness. Here, the silent grief and heartbreak is there. Then the califos, nervous weakness, exhaustion, depression, brain fatigue, memory issues. Here, the chronic stress and less of self worth or emotional depletion or the self devaluation is activated. Fair and force, early inflammation of the thyroid and low grade fever, anemia, dullness. Here, hidden conflict related to emotional sphere. Then make force, cramps, neuralgia, nervous hypersensitivity, then menstrual irregularities, here the suppressed feminine identity, then the silesia, slow metabolism, coldness, weakness, resistance, exhaustion, glandular swelling, here the chronic lack of confidence or lack of assertion, then the natrum force, it is related with the acidity, nervous tension, hormonal imbalance, and obesity. And here, guilt, emotional acidity, and suppression of the anger. Then, Kali self, obesity related with the sluggishness, recurring glandular complaints, skin eruptions. Here, internal conflict is unresolved, and person may stuck to some emotional phase. So these are the bio combinations suggested for the hypothyroidism. You can combine Calcarea force with Kali force and Natramure. You can combine Calcarea floor plus Silesia and some fibrous tissue or changes is there. Then you can combine Kali force or make force as a supplementation in case of nervous and mental exhaustion with the hormonal changes, than natrum force plus natramure in hormonal imbalance with the emotional suppression, acidity, and constipation. So let's check out some mother tinctures related with the hypothyroidism. Amina sativa is related with the general debility. It acts as a nervous tonic and giving a endocrinal support. Then Vithiana somnifera, that is prepared from the ashwagandha, and it will reduces the stress and gives the adrenal and thyroid gland as a support by reducing anxiety and depression. So it is indicated for the autoimmune thyroiditis, especially in case of Hashimoto thyroiditis. Ginseng act as a general tonic. It improves the metabolism and energy level, reduces the fatigue and lethargy, feeling and stress. It will give stamina to the patient. Then alfalfa, appetite enhancer, improves the digestion, restore the weight balance, and it is useful in the hypothyroidism weight related fluctuations. Then the Echinococcosis, it is indicated for the mental fatigue, stress recovery, and low immunity, and it will balances this stress and thyroid excess. Then Chionanthus, it improves the liver functions, related with the thyroid disorder. Then saccutaria, it is indicated in a nervous exhaustion like a kali force. It improves the muscular weakness, insomnia, and glandular disturbances. And it will indicate it for the anxiety and restlessness. Then ignatia causes suppression, or there is a lump sensation in a throat. It is indicated in a acute grief. It will resolve this hormonal imbalances developed due to the emotional grief. Then lecithinum, mental exhaustion. It is good for the mental dullness. Then centilla, it is for the mental fog, memory loss, glandular support. It is Brahmi, which is used to improve the dementia and memory. Then iodium, it is useful or often indicated in an early stage as a thyroid stimulant. Then if we consider the emotionality, we have to consider the batch flower remedies because it is indicated on basis of the emotional plane only. So the large indicated for the low self-confidence, fear of failure, anticipated, and it is indicated for the powerlessness. Then ill, overwhelmed by the responsibility, feel burdened by the expectation. Then gentian, it is indicated for the easily discouraged or doubt after the failure, conflict related with the disappointment. Then the wild rose, apathy, resignation, then lack of interest in the improvement. Then willow, resentment, bitterness, feels life is unfair to him or her. So it is related with the injustice, conflict, and often it is indicated with the autoimmune thyroiditis. Then the olives, physical and mental exhaustion. It is related with the post-conflict exhaustion. Then the hornbeam, mental tiredness from the routine, lack of enthusiasm. Then minimulus, known for the fears, fear of the illness, failure, or financial loss. Then clematis, that is dreamy, unfocused, indifference, no entrance in the present. Then pine, related with the guilt, self-blame, self-devaluation, constantly apologizing to others. Then Arjimani hides no worries, appears cheerful but suffers in the silence or when he or she is alone. Then Gore's hopelessness, has lost belief that anything can help. Then Mustard, it is helpful in sudden depression with no apparent cause. So these are the biochemic medicine. Now let's check out the repertorial view. So various repertories has given many medicines related with the hypothyroidism under many rubrics like hypothyroidism, myxoedema, thyroid goiter, thyroid gland. Then in a Zomeo homeopathic software, we will find many thyroid organ or disease specified rubrics and medicines. Then an herring repertory or our materia medica, we will find this chapter 31 related with the neck and back. And here we find the many rubrics and medicines, even single medicine indicated rubric also related with the thyroid. If we consider this repertorial study rubric related with GNM and medicine and conflict, so symptoms like sluggishness, mental dullness, mind slowness, sluggishness, and various medicines like graphitis, lycopodium, baryta, carb is indicated when conflict is related with the feeling incapable or not good enough. Fatigue, chronic exhaustion, journals, weakness, chronic. Phosphoric acid, gelsemium, that is the long-lasting unresolved stress. Sadness, depression. Consider rubric mind, sadness, depression, chronic. So sepia, aurum mat, pulsatilla, calcareaca. And conflict is related with the grief, resignation, and loss. Sensitivity towards cold, journals, cold, aggravate, chilly patient. Silesia sorinum calcarea hepa lachesis, where vital force is withdrawn from the emotional trauma. Then dry skin, roughness, skin dryness, graphitis, sulfur and petroleum, and many medicines are there, having withdrawal and neglected feeling. Then constipation with inactivity, rectum, constipation, inactivity of rectum, opium, alumina, bryonia. So letting go conflict of struck emotional is activated. Menstrual disturbances, female genitalia, menses, irregular, scanty, delayed. So sepia pulsatilla murex calica is indicated. Our conflict is related with the sexual self-worth and identity or womanhood. Then the weight gain, stomach appetite increase with the emaciation or the fat. Various medicines are indicated like capsicum, calcarea carp, thyroidina. Puffy face, eye swelling. So face swelling, eyes, eyelid or face bloated appearance. Calica apis graphitis. Here the survival conflict. Hair fall, dry, brittle hair. So hair falling, fluoric acid, phosphorus, sepia, natriumur, vinca minor. Identity conflict, hoarseness of the voice, larynx, voice, hoarseness. Causticum hepar, so spongia. Communication conflict, suppression of the voice. Goiter, thyroid swelling. Neck swelling, thyroid gland. Iodum, spongia, fucus vesicularis, thyroidina. So powerlessness or attack conflict, memory weakness, mind, memory, weak, defective, anacardium, lycopodium, graphitis, caliphos. So brain fag due to conflict is overloaded, apathy, indifference, mind indifference, sepia, phosphoric acid, thuja, sulfur, conflict on basis of emotional plane, anxiety, inner restlessness, mind anxiety, restlessness, arsenic, natriumur, aconite, that is the conflict active phase. So here are the rubrics related with the hypothyroidism. So if we correlate this conflict, homeopathic medicine, rubric and symptoms, there is the correlated table like powerlessness, I can't cope, I am too slow, feeling incapable. Rubrics are there and medicine indicated like Lyco, Calcarea and Silesia. Self-devaluation conflict, it is related with the performance, that is person is saying I am not good enough or feeling worthlessness. Then rubrics are there, mind inferiority complex or worthlessness and depression, where suicidal tendency is activated, natriumur, aromat and stephysagria. Then overburden conflict, feeling burden with the responsibility or emotional weight. Various rubrics are there and medicines like sepia, calcarea and naxvomica. Then fear of not being fast enough, conflict is acting fast or react fast. That mind hurry, hassle, mind fear failure, mind anxiety performance, where anxiety related with the performance indicated medicine like argentum nitricum, gelsemium and lycopodium having performance anxiety. Then the indigestible or anger or injustice conflict, where they are swallowing some unfairness to them. So mind anger suppress, mind mortification, mind elements from here stephysagria, ignatia and natriumur, where dwells on the past injustice is indicated. So we find out some complementary or alternative therapies also related with this thyroid hypothyroidism. So watch out your nutrition or supplementation. Take food rich with the vitamin B complex and iron. Avoid broccoli, cabbage, sprouts, cauliflower, spinach, turnips, soya beans, peanuts, pine. What is not to eat is more important rather what is to eat. So here avoid this stuff, millet, mustard greens, and eat foods having a high oxidative stress or antioxidants, including fruits. Avoid alcohol and tobacco. Take omega-3 fatty acid rich diet. L-tyrosine. Do not take any iodine supplementation uh, if it is not directed by the physician. Acupressure may be indicated, and calcium supplementation, iron supplementation, and aluminum hydroxide is given to relieve the constipation and fulfill the demand of this anemia and osteomalacia. Few cases are there. Uh, Case 1 related with the burden homemaker conflict. We'll quick give a review regarding few cases. This is the short brief of the cases. We are not going in a detailed case. We are just taking the prescribing totality over here. So, chief complaint: fatigue, hair fall, dry skin, weight gain, irregular menses. So, emotionally, he feels overwhelmed, suppressed emotion, low self worth, or emotionally exhausted. So here powerless conflict is activated, and we consider mind indifference, general cold aggravation, mild weak memory, mild sadness, and skin dryness taken as a rubric. And on basis of this, sepia medicine is selected and given in a 200 single dose because it is based on the psychotic miasm. So after 2 weeks, we observe there is a changes in her energy level, and menstrual cycle is regularizing. And after 2 cycle, this emotional balance is returned, and she feels better. Then case 2, 42-year male, stuck ladder, sluggishness, slow, a speech, bloated face, forgetfulness, cold intolerance. He feels like a fail at work and unable to express or make decisions. Conflict is not able to keep up or self-devaluation conflict. And totality, slowness, bloated face, memory, and low confidence. And a rubric is considered like mind confidence, want of face swelling, mind memory weak, mind slowness. On basis of this, lycopodium medicine is selected, and depending on the susceptibility and other phases, we have given lycopodium 1 mg single dose, and we were repeated after the 15 days. Here the psychotic and soric miasmatic influences is there. So after 2 months and 4 doses, this bloating is reduced, energy is improved, and he is more confident in his decisions. Than female, 29 years, hoarseness of the voice, hair fall, dryness of the scalp, sleep disturbed, slow sleep. There is the history of emotional suppression due to the loss of father. Then not being heard, conflict is activated. And rubric we consider voice hoarseness, hair falling, sleep disturb, mind grief elements from. And depending on this loss and grief, we indicated medicine Ignatia and give her in a 200 potency weekly 1 dose for 3 weeks. So here the soric or tubercular tendency is activated. So after a month, her hoarseness is improved and emotional discharge has started by second week, and hair texture is improved after a month. Then hypothyroidism with amenorrhea in married women. So hypothyroidism, diagnosed case of hypothyroidism is comes with the disturbed menstrual cycle since 6 months and amenorrhea since last 3 months. So here identity conflict or loss of femininity or role due to the marital or family stress is activated. And totality will consider amenorrhea, sadness, feeling of disconnection, fatigue, chilliness, and hair fall. And rubrics absent, then mind sadness, mind 4 second feeling, in general weakness, general cold, aggravate, and hair falling. So depending on this totality, we have prescribed pulsatilla in a 200 potency once weekly, and after a month we will observe this appearance of the menstrual cycle. And then it will remains constant on placebo for more 3 months, and this menstrual cycle appears regularly. So after follow-up 1, there is a crying tendency is decreased. After follow-up 2, emotionally she is more stable. After 3, breast heaviness is appear and hormonal changes is expected. After 4, spotting is observed, hair fall is reduced, and patient is very hopeful. So depending on the psoriatic and the psychotic trait, here we consider pulsatilla as indicated medicine. So here the next case related with the amenorrhea only, that we have already seen this case. So here are the reports or proof of the patient recovering from the hypothyroidism. So, at last, hypothyroidism is not just a biochemical disorder of low thyroid hormone, but it reflects the deep rooted emotional and biological conflict, as we studied today, correlation with the GNM. So, GNM highlights the identity and self devaluation conflict as a key contributor, especially in a woman post marriage, during motherhood, or major life transitions. So, homeopathy adds a individualized and miasmatic understanding and offering the long term balance through the dynamic medicine based on the totality of the symptoms, on the constitution, and considering individuality. So when the homeopathy and GNM work together, they don't treat the thyroid. They treat the woman who lost her identity, the child who feared rejection, the man who felt helpless, and in doing so, restore the inner balance. So true healing begins not when we suppress the symptoms, but when we understand the story behind it. Thank you all.
Thank you, ma'am. Thank you so much for the in detail explanation regarding the hypothyroidism with the functions and the different remedies, including the batch plumber remedies, homeopathy remedies, and with the repatriation part also, and the dietary part also. Ma'am, actually, can you kindly elaborate regarding the dietary also, ma'am, a little bit more?
Sorry, ma'am, I'm not able to understand.
Dietary concept regarding the hypothyroidism, ma'am. Can you kindly elaborate it, ma'am?
Originally, you have not to take about this broccoli, cabbage, millets, strawberries, because it will suppress the thyroid secretion. Okay, even spinach is not indicated. And if we also advise to avoid cheese and major outside dairy product except the milk, buttermilk, and curd. Or you can avoid this cheese, paneer, and you can say your extra added fatty stuffs, okay, related with the animal products also. Okay, so you consider this inclusion of this pure veggies, fruits. You can eat grain, you can eat wheat, rice, it's okay, fine, but it is in a, you can say, regularized amount. Don't include many sugary beverages, or you can say teen products or store products or already cooked preserved food. So you should avoid it, because preservatives we are using nowadays in this foods are affecting the hormonal orchestra of the women. Okay, and we will find this major issues related with the food in case of PCOD also. And that's why this PCOD, hypothyroidism, even hypertension and diabetes is related with the lifestyle modification or lifestyle change disorder. If you change your lifestyle, your food habits, include some daily activities in your diet, take proper sleep, and take healthy diet by avoiding this kind of food stuff, or uh, adding some more healthy stuff in your diet, you will resolve this hormonal imbalance with this.
Yes, ma'am.
Hello.
Thank you. Yes, ma'am. Yes, ma'am. Thank you so much, ma'am. Any other doubts from the participants? I hope they are clear with the topic, ma'am.
Okay.
Yes, ma'am. Thank you, ma'am. Thank you so much for the elaborative session. And we have learned so many things also in this session regarding the repertorial part, regarding the dietary part, and regarding the biochemic remedies which can be prescribed, and the mother tincture part, and the and the homeopathy medicines which we can supposed to give to the hypothyroid patient. And thank you all. Thank you, ma'am. Looking forward for
Thank you,
many more
dear.
sessions, ma'am. Yes, ma'am.
Okay. Thank you,
Thank
dear.
you all the participants. Thank you, ma'am. Yes, ma'am.